Thanks, Sean Corley. Minister, I just want to go back to that issue of pregnant women and you confirming that they'll be offered an mRNA vaccine between 14 and 36 weeks. But they've been left not knowing what the plans are, what the situation is. And I think it's particularly worrying for people who are, past 30 weeks of pregnancy. They don't know whether they're going to get it in time for that cut-off of 36 weeks. So what is the situation? Has that process begun? Who's going to be responsible? Who is responsible for registering pregnant women? And where and who will be actually administering those vaccines?
Minister.
Thank you very much, Deputy. So the advice came in from NIAC and the HSE is currently working through. I'm going to read you out exactly. This is the latest presentation from the Vaccine Task Force as of this week. And on the NIAC recommendations in regard to vaccination of pregnant women, it says this will be implemented and a working group has been established led by the Women and Infants Programme to develop the referral pathway and an operational plan as soon as possible. So that's directly the latest report from the task force. I want to see it, you want to see it in place very, very quickly. I think we just need to be aware that there's a lot of complexity being managed within the vaccine programme. The NIAC recommendation for pregnant women came in as one of a series of recommendations and changes. And so while we all want to see this implemented almost immediately, it does take a little bit of time to get the referral pathways in place.
I accept the complexity involved, but this is a particular cohort that are time limited, unlike many others. And it's not really fair to leave them in that kind of limbo where they don't know what the plan is. And, what does as soon as possible mean? That's not good enough. And I'd ask you to try and get some kind of concrete timescale so people know where they stand and when they're likely to receive it. And those other, practical issues in relation to registering, who'll give it and all of that. You've announced it without any of the detail, and that's not very satisfactory. So if you can provide that detail as soon as possible, and I'd ask you to try and do that certainly within the next week. I also want to ask you just about the role of pharmacists. Now, you've said about a pharmacy network. They're ready and willing to do that. Can you now give a timescale of when pharmacists are likely to be brought on board to start providing that service? And in that respect, I'd also just highlight the fact that there's a very significant dip in the administration of vaccines every weekend. It's Saturday and Sunday. Last week, this week it was Monday as well, where the numbers dropped down to about 12,000 or so, which is just not acceptable really at this stage when it should be rolled out as quickly as possible. And pharmacists obviously have a key role there. So what's the timescale for the pharmacists being involved?
Thanks, Deputy. With regard to the pharmacists, it will be in the coming weeks. I've discussed this at length with the HSE. I want to see the pharmacists playing a more prominent role in this. I know they're ready to go. We've had an agreement in place with them for a very long time. The IT systems and the portals for the pharmacists there's pilots with a number of community pharmacists right now. As I was saying earlier on, the view from the vaccine programme is that the capacity that they bring hasn't been required yet. However, the volumes are increasing very significantly, and I want to see them brought in very quickly. So at this point, the answer is in the coming weeks. Can I just say, in terms of the fact that the HSE is still working out the detail for administration of pregnant women, I fully take your point. Obviously, by definition, this is a time-limited group of people, and I will take it back to them. In terms of announcing it without the detail, to be fair to the HSE, we announced the NIAC recommendation, and then we just need to leave a bit of time for the HSE to work it through.
Generally seen as one and the same thing, so we need that detail. Look, Minister, I want to ask you just about that cohort of people that received the AstraZeneca before the advice came out on under 60s, and it's now under 50s. So as of today, there's about 7,500 people, healthcare workers, who would have been due to get the second dose today. The 12 weeks would have been up. So what is the situation about that group? You've suggested waiting until 16 weeks, but is that for all of that cohort, or is it just the under 50s? And what's happening about the over 50s then?
Thanks, Deputy. I'll read you out the exact advice on specifically on this from NIAC. So AstraZeneca recommendation for dose 2 interval, and the HSE is pointing out there's a lot of complexity involved, but here it is. Dose 2 for the over 50s and for those who are very high risk or high risk will be given at 12 weeks, and that's from mid to late May in line with supply. And for the under 50s who don't have a high risk or very high risk underlying condition, it'll be administered on a 16-week basis. So the majority of the people you're talking about will be, I would imagine, are under 50, probably don't have high risk, some of them may, but don't have high risk or very high risk conditions. And for that group, it's 16 weeks.
Minister, just how are you distinguishing between the two of those in terms of under 50 and over 50? And will people be notified automatically? Or do they have to go and register again?
Yes, they should be notified. So the two distinctions are 50 and older, and then under. So 50 and older is 12 weeks. Under 50, if you're high risk or very high risk, it's also 12 weeks. And then under 50, if you're not high risk or very high risk, it's 16 weeks.
Just one very last one. For people over 60, in their 60s, are all of those only receiving the AstraZeneca? Or are any of the other vaccines being provided to people in their 60s?
The broad intention is AstraZeneca. However, there may be cases where people, if there is availability, for example, of an mRNA vaccine or indeed of Janssen, that can be used. We've received very little Janssen so far, and as you've been aware, you'll be aware, we've started rolling that out now, for example, with homeless, which I think is really, really positive to see. So it is possible at the margin that some people in that group, based on availability of supply, would receive an mRNA vaccine or might receive Janssen, although the numbers are low. But the broad thrust is that it's AstraZeneca.